Hi, everyone. Kristen with Mon Health here. We are here for our coronavirus COVID-19 Facebook Live event here at noon. We're so happy that you were here to join us. We're here with Dr. Vasudevan with infectious disease and Dr. Edwards, emergency medicine, medical director of the emergency room. So glad you were both able to join us. We know this is a massive community event here to help you at home. I know there's a lot of questions surrounding COVID-19, how to keep you safe. So we're here to do exactly that. So again, keep your questions coming in onto our Facebook page. We're here to facilitate those questions and get them answered for you. So we'll run through some of the top questions we have so far. The number one, what is COVID-19? Dr. Vasudevan, you want to take that one?
So COVID-19 is respiratory viral syndrome. It's a virus that started end of December in China and has since spread globally. The one thing different about this is how fast it spreads and how contagious it is and how sustainable its spread is in the community. People can present with mild symptoms. They may not even have any, just have some cough, mild fever, or they can have more severe symptoms with fevers, chills, difficulty breathing, or chest pain, or they can go on to have even severe symptoms needing ICU treatment and support breathing.
Okay, that explains a lot. That was actually one of the next questions. What are the symptoms? How exactly does COVID-19 spread?
The most common method for spread is what's called droplet spread. Basically, when someone coughs or sneezes, the virus gets airborne and gets trapped in some water particles. And when there's another person standing nearby, this can get into their eyes, their nose, their mouth, or get inhaled and go into their lungs, and it can cause the infection. Much less likely, but other methods for infection are also when the virus is on a surface and someone touches this surface and then touches their eyes, nose, or mouth, and thereby get the infection.
Okay, that was actually the next question. How long does the virus stay alive on surfaces? How long can it stay airborne?
Since this is a relatively new virus, there's not a lot of data on it, but there was some studies that were published quite recently after they did some experiments. On plastics, stainless steel surfaces, they concluded that it can stay alive up to about 72 hours. They did some experiments where they aerosolized and made the particle airborne into little droplets, and that was suspended for about 3 hours or so. And the amount of virus in it did come down incrementally and slowly over the next few hours. It is hard to estimate how much of it is alive, because the testing, when you test the particles, it tests for just the RNA virus. It doesn't really tell you if it's alive and can transmit the infection, but it was still testable for up to 72 hours on plastic and stainless steel surfaces in the air for about 3 hours or so.
Okay, I know there was a lot of speculation about how that works, so that does help with the next question too. Both of you are at the front line, so you can both probably answer this. What is the best way to protect myself?
All the guidelines by the CDC are fairly simple and common sense. You need to stay home. You need to stay out of the public. You need to stay away from people. As Dr. Vasudevan said, the close contact is within 6 feet of each other. So it is about distancing. It's about staying away. If you are elderly, over the age 60, 65, you need to stay at home as much as possible. You are at more risk to get this and potential for more serious complications. If you have any significant medical problems, diabetes, lung disease, chronic kidney disease, along with being immunosuppressed on any type of chemotherapy agents, again, stay at home as much as humanly possible. That is the best and only way to prevent yourself from getting this.
Anything else you want to elaborate on that?
Others who are outside, I would recommend washing your hands frequently with soap and water for at least 20 seconds. If that's not available, go for alcohol-containing hand sanitizer with at least 60% of alcohol. Try not to touch your eyes, nose, mouth. It's hard, but we have to practice it. Other than that, if you see a sick person, stay away. If you are sick yourself, like Dr. Edwards said, stay at home.
Okay, perfect. This was a very good question. I know I read a lot about it. Does ibuprofen worsen symptoms? There's been a lot of speculation about that.
A week or so ago, out of France. They got published that they thought ibuprofen may interact with some enzymes with the coronavirus that could actually make you sicker. Since then, several sources have said there's not good scientific evidence of that. But with that being said, we do have alternatives to ibuprofen to reduce fever and body aches, such as acetaminophen/Tylenol that's easily available over the counter.
Okay. Alrighty. Next question. Can children get it and can they show symptoms? Can they be symptomatic?
So children under 10 years of age have had some tests that were positive. For example, there was just a case report that came out of London about a newborn who tested positive. But for most part, based on all the data that has come out of China, based on data that came out of United States on about 4,000 people up until the 15th of March, there were very few cases under 20 years of age. Under 10, there were no cases at all, and there was no mortality, which means no pediatric deaths. So that's very good news. Kids seem to have milder infections based on all the data that's coming out. There was one case of an infant who needed some breathing support, but that was less than 1%, and most kids seem to have good outcomes with mild infections.
Okay. Now, children also, though, just like us, they can be carriers.
Mm-hmm.
So, I mean, even for myself, if I have a little baby, should I not bring the child around my parents, who are baby boomers? What do you do for something like that?
Thank you for that question. That's
Sure.
a very important question. Right now, I would recommend avoiding visiting anyone. The social distance we are talking about right now, it's important not just because it helps prevent the infection for us, but it also helps prevent the infection for our most vulnerable people in our community, our elderly, and those who have other immunosuppression. When we avoid transmitting the infection to others, the number of infections that get transmitted across the community goes down quite a bit. And that's our biggest way for now to fight this infection. So I would recommend avoiding all visits for now.
Okay, makes perfect sense. It almost echoes exactly what you were saying. What if you only have some of the symptoms? Do you still go to the doctor? What do you do?
The current recommendations by the CDC are if you exhibit mild symptoms and have risk factors for which you might have been exposed to coronavirus, the recommendations are very simple. Stay home. If you have mild shortness of breath, fevers, the cough, if you've had exposure to somebody being tested, traveled outside the United States or to one of our states that have shown community spread and have mild symptoms, the CDC simply says stay at home and quarantine yourself for 14 days. Typically, we don't need to test to see if it's positive. We do have a limited supply of testing kits, which are being saved for sicker folks that meet specific criteria.
Okay. We still have a lot of great questions, but I want to make sure I get to a lot of especially our drive-through. We want to make sure we talk about that. A couple more. Is COVID-19 more harmful to pregnant women? We have a lot of ladies that are concerned about that.
So there was some limited data out of China that came about 9 pregnant women who had deliveries. They tested positive, but it did not really change any outcomes as far as how the baby was delivered or if the baby tested positive or if the baby had any symptoms. So far, the information that we have does not seem to show that pregnant women have any worse outcomes because of COVID-19. All the same, this pregnancy state is a very immunosuppressed state by itself. So I would recommend practicing all cautions, much like you would practice otherwise, to prevent yourself from getting any infections.
Okay. Do you have to have a doctor's order to be tested? And kind of mimicking that, how long does it take to get results back?
So the way the testing is going on through Mon Health right now is we do have opened up our drive-through screening process this morning. You can see the website for the phone number and hours for that. Essentially, you call in. We ask you some screening questions to go over the CDC criteria to see if you're at risk for coming in contact or being positive for COVID-19. If you meet the screening questions and the criteria, We will get you pre-registered, let you know you're in the system, and you're able to come through the drive-through at that point in time, which is as you're coming back towards our emergency room at our Surgicare South area. We get you through the line, get the testing done appropriately. If you present to the emergency department, it's very similar. If you meet the criteria, have the illness, the symptoms, then we have a designated area that we're using to do testing for that. Initially, the test, once it gets started, only takes about 6 to 9 hours to be run. However, with the amount of tests that we're doing currently, we're seeing somewhere around a 3 to 4 day turnaround to get those results. So once you're tested for this, we ask that you immediately go home, nowhere else, not shopping, not to pick something up, directly home, and you quarantine until the results come back. And then we're able to notify you to let you know if you're able to be out of quarantine or if we need to continue it.
Okay. And just to echo what you said, we do have that number available. So just so you all know, we have it on our website as well. But just to reiterate, the number to call before you come to
Yes.
Mon Health and before you come to the drive-thru, you want to make sure you call this line. It's very vital. The number is 304-285-3798. And again, the drive-in testing is right whenever you're entering the hospital grounds. It's right off to the left.
We have signs up as you come in to direct you for the drive-through testing pre-screen. We have our security out there to help direct you so we keep everything flowing as smoothly as possible.
Correct, also. And one more question. Anyone who is tested, we want to make sure we reiterate this, should stay in self-isolation until results are available.
That's absolutely imperative. Except clearly, if we're testing you, we feel that you have a chance to have come in contact or have risk factors to have acquired COVID-19. And as we've talked many times during this conversation, social distancing is the key. It is the only way, the only mechanism which we have control to stop and slow the spread of the coronavirus in the United States and in the world. So it's absolutely important that you go home, you quarantine yourself at home. And what the recommendations for quarantine are, if you live by yourself, obviously stay inside. If you're with family members in your house, they recommend that you have a room to yourself, and in that room you don't need to wear a surgical mask. If you are out in the house around your family members, obviously limit the people that are in your house, then you need to have a surgical mask on to reduce the risk of passing this to family members. The other statement from the CDC is if you have symptoms and family members develop symptoms, they should also be self-quarantined for a 14-day period.
Perfect. Actually, speaking of masks, do we have a mask available
yes.
we can show?
Yes.
I know a lot of people had questions about how to properly wear the mask. Some people accidentally wear it upside down. They don't cover their mouth. Do you want to?
Yes. So basic surgical mask. The top portion has a little piece of pliable metal in it. That's where the top portion goes. So you simply take the mask and extend it so it covers everything. You have the pieces that go over your ear. So you simply put these over your ears. You reach the top part up over the crease of your nose, right below the nasal bridge, and you simply squeeze. And once you squeeze, that is set. The proper way to take this off, should you come in contact with it, is to take your fingers on the loops behind your ears and simply remove it. Once you remove it or take gloves off or come in contact, please make sure you wash your hands, soap, hot water, 20 seconds, or an alcohol-based sanitizer.
Dr. Vasudevan, Dr. Edwards, we had a couple questions from our staff at Mon Health Medical Center. A couple of the questions, really great questions. When to wear a mask? What type of mask? Should they be N95s? What should they exactly do? And do we have enough PPE to get us through the pandemic?
So that's an excellent question because our healthcare workers are our first line of defense when we go see the patients, and how to protect ourselves is really important, and then how to protect our patients is just as important. For healthcare workers who are taking care of a patient who has confirmed COVID-19, either an N95 mask or a PAPR mask is recommended with its hood. For those who are taking care of patients who have respiratory symptoms but do not have COVID-19, regular surgical mask would be enough. For healthcare workers who are taking care of patients who do not have any respiratory symptoms, they do not need a mask. Additionally, it also depends on what procedures are going to be done for the patient. If the procedure is going to generate a lot of aerosol, they will need to practice appropriate PPE use. Okay? All right.
And just to add on to that, with the aerosol treatments, if we do have a confirmed COVID-19 case in the hospital that requires that, we do have negative pressure rooms to have them in to give them the appropriate aerosols at that point in time. And to go along with, if we have positive or waiting on results on a hospitalized patient, along with the N95 mask, full PPE with glasses, goggles, your drape and your gloves on for that to help protect yourself.
Okay. We also have a video available on our MonNet about what are the proper methods to don your PPEs, and more importantly, what's the proper method to doff the PPEs without infecting yourself. So it's important that everyone review that a few times before they have to gown themselves and go into a patient's room.
Okay. And maybe we could just stress also that as far as overall staff safety, I know a lot has been put into place as far as social distancing, virtual meetings, telework, monitoring of travel. Other one, you want to kind of elaborate on that, what you have seen? I've seen a lot of changes.
Yep. Yeah. Absolutely. And some of the stuff we were talking about is the whole objective with this is to keep our patients safe, keep ourselves safe, and keep our families safe. And some of the concerns that I've seen and we've heard around the hospital is, what do I do if I have somebody who has some type of immunocompromisation at home, or someone's pregnant at home? Can I take this home to them? One, if you're following appropriate steps at the hospital by the videos of how to put on and take off your PPE equipment, that eliminates the large majority of concern. However, with that being said, when I work in the emergency department and we see these patients, my suggestion, if you have folks at home who could be at higher risk, simply before you go in your house, have a spot where you can get rid of your clothes that you worked in for the day and be able to wash them. Simply wash your hands again. Warm water, soap, at least 20 seconds. Use alcohol-based sanitizers. And then within the house, common sanitary use. No sharing of drinks, sharing food. When you cough or sneeze, make sure it's into the inside crease of your elbow so that nothing is being passed if there even is remotely a potential for an exposure.
Perfect. All right, Dr. Vasudevan, Dr. Edwards, thank you so much. This is so vital. So many people had questions on how to stay safe through this tough time. Just to reiterate again, the COVID line, 304-285-3798. This is the number to call before you make your way over to Mon Health for the drive-up testing site. Again, that's right whenever you're driving in off to the left. There are people available there to do the testing and make sure that you're staying safe in our community. All right, everyone, thanks so much. Thanks from Mon Health, from all of us. Have a wonderful day.